Welcome. Does breast or nipple size affect breastfeeding? The short answer is no, but I'm sure you've come here for a more detailed look at why. Let's look first at breast size and how that impacts breastfeeding. In your breast, there's a mix of what we call functional tissue and fatty tissue. We all have both types of tissue in our breasts, regardless of size. However, larger breasts do tend to have more fatty tissue than small breasts. As the name suggests, it is the functional tissue that is responsible for making milk for your baby. There are two things that happen when milk is made. Think of it like factory production and warehousing. When your breasts feel full, this is because the warehousing capacity for milk storage has maxed out, and it causes factory production to slow until baby feeds again. This slowing of factory production is actually why we recommend frequent feeds. As if factory production grinds to a halt too often, with full breasts, its production capabilities slow down overall, leaving less milk for your baby. If your breasts are full, however, when your baby latches on, you may find them gulping away for the first minutes of the feed as they work their way through that stored milk. This doesn't mean that if your breast feels soft, you have no milk. Your brilliant body has that factory production going 24/7. In fact, the emptier the warehouse, the quicker your factory is producing milk. More on this in episode 8. Breast size does not impact this process, and it is impossible to draw conclusions about supply from simply looking at breasts. However, your breast anatomy can impact which feeding positions you find more comfortable. For example, someone with smaller breasts with easily visualized nipples will find that cross-cradle position is fairly easy to achieve. However, they may find that side-lying in bed is tricky as their breast doesn't fall to the mattress, giving baby easy access while lying next to them. This woman may find that a laid-back position, think watching TV in bed, with her baby on her tummy is an easier nighttime solution. Conversely, a lady with very large breasts or breasts where the nipple points downwards and isn't easily visualized may find cross-cradle a virtually impossible position to achieve. In this case, she may prefer a cradle position or even using a prop under her breast for support to give her better visualization of the nipple. Regardless of breast size and nipple placement, the important thing is to find a position where the baby is doing the following as they approach the breast. Chin up, chin into breast, nose to nipple. If your baby approaches the breast like this, even if it's using a totally non-conventional position, you will likely get a good latch. One of the most common worries I hear from mums is that their nipple shape or size isn't right for breastfeeding. Many worry that it's too flat, too wide, too long, too inverted for their baby to manage. My perspective is this. Up until very recently, in the scheme of human history, babies were presented with some fairly harsh realities about their survival. They could learn to breastfeed from the set of breasts and nipples they were presented with. They could feed off a wet nurse if they had rich parents, or sadly, they would fail to thrive and survive. The way that evolution works is that if there was a nipple type that was incompatible with breastfeeding, the children of that unfortunate woman would not survive through to adulthood to reproduce themselves. They would then not pass on the genes for bad nipples, and eventually such nipples would disappear from society. The very fact that there is such diversity in nipple size and shape and length proves to me that historically women successfully breastfed their babies regardless of nipple variation, and that they all work. The other thing to remember is that your baby will learn to breastfeed from the breast they're presented with. You may feel insecure about your breast or nipple size or shape, but your baby doesn't judge or compare. They learn and adapt to their unique situation. There are a couple of anatomical types that are more vulnerable to complications if we're not careful, however. Long nipples. In this case, you will find it quite easy to latch your baby to the nipple, but can struggle a little to ensure they get a mouthful of breast tissue in addition to nipple. They need this mouthful to effectively drain the breast of milk. For these babies, pay particular attention to the chin up, chin in part of the latch. Having their chin on the breast will help them to get a good, deep mouthful of breast tissue as well as nipple. Flat or inverted nipples. This shouldn't be a problem initially, but these babies are more prone to nipple confusion if a bottle is introduced too early. There are a myriad of cues to tell babies they've arrived at the breast and to start sucking. One of these is the nipple gently tickling the roof of their mouth. This cue will be absent in a flat nipple. However, because there are many other cues, and because they've never known any differently, these babies won't notice it's missing. If a bottle is introduced in the early days, that firm silicone teat of the bottle will touch the roof of baby's mouth in a very clear signal to start sucking. When those babies come back to the breast, a small percentage of them may find it confusing to know when to start sucking without this cue. This is one of the reasons we recommend not introducing a bottle until feeding is established. In summary, you really shouldn't worry about what your breasts or nipples look like. To your baby, they look perfect and will soon be their favourite thing to see. So, to recap, breast size and nipple shape do not affect the ability to breastfeed, as long as the baby is able to achieve a good latch. Breast size can impact which feeding positions are most comfortable, and mothers with larger breasts may need extra support to get a good latch. Nipple size and shape and placement are all variations that have successfully allowed babies to breastfeed throughout history, and baby will adapt to the breast they are presented with. However, long nipples may require extra attention to ensure baby gets a mouthful of breast tissue in addition to the nipple. While flat or inverted nipples could cause nipple confusion if a bottle is introduced too soon.